From the San Francisco Public Press, this is Civic. I'm Sylvie Sturm.
When I came to America, I experienced homelessness. I was lost and confused. A friend recommended I go to Larkin Street.
There's a youth program on Larkin Street that offers young people in need a place to find a doctor, a therapist, a meal, a case manager, and sometimes hope, all under one roof. It's a model that San Francisco pioneered 60 years ago, one that spread across the country. But earlier this year, health officials said federal Medicaid cuts and budget pressures left them no choice but to end primary health care at two centers serving some of San Francisco's most vulnerable young people.
These have been gut-wrenching decisions.
Clinic supporters say the decision will only cause more harm.
You can't not invest in young people and expect the community to be built up of successful, intelligent, healthy individuals.
This is the story of how San Francisco went from pioneering low-barrier care for youth to dismantling parts of that system. I'm Sylvie Sturm. You're listening to Civic.
Hey, what brings you in today? My name is Lisa. Let's go to the back room and let's just talk.
Lisa Cadillo has spent more than a decade caring for young people at San Francisco's Michael Baxter Larkin Street Youth Clinic. Every day, she greets young people walking through its front door in the Tenderloin neighborhood. Some are familiar faces. They're the ones who call her Auntie Lisa. Others she's never seen before. When they arrive angry, frightened, or completely shut down, she doesn't start with paperwork. She starts with a conversation.
There's no stigma. It's totally fine to talk to people. And even if you just want to sit with me in the room and not say anything, that's cool too. Whatever you're comfortable with.
She's not always sure what she'll hear. Maybe they're hungry, escaping violence, or they just need someone to trust. She's learned not to assume anything, and more importantly, not to take anything personally.
Some kids, they come in and some of them have an attitude. You don't know what's going on in this young person's life right now. That's why they're taking it out on you. We have to go back to where we were young. We went through stuff as young people, and didn't know how to talk to people correctly.
Cadillo doesn't hear defiance. She hears pain because she recognizes it.
I was born and raised in the Mission District and grew up in Bayview Hunters Point, and so I seen a lot of kids that were just like me, but no one to really help them.
That's why she wanted to work in the Tenderloin. It's where many of San Francisco's most vulnerable young people end up after leaving home, aging out of foster care, escaping abuse, or losing stable housing.
A lot of these kids have grown up like I did. I was in a home where my dad was really abusive to me. And I've had a relative who touched me. And so I can relate to a lot of things that these kids go through. And my thing is that, you know what? Don't let it define you. You can come out of it.
The Larkin Street Youth Clinic was built around a simple idea. Young people shouldn't have to navigate a maze of separate agencies to rebuild their lives. Rather than expecting vulnerable youth to navigate a fragmented system, service providers brought combined medical care, behavioral health, case management, and basic services to them. It embedded specialized youth clinics in the neighborhoods where the need was greatest. For 22-year-old Yessie, that meant finding much more than a doctor.
When I came to America, I experienced so much, including homelessness and racism. I was adopted by family here in the Bay Area, and I got kicked out. I didn't know where to go. I was lost and confused because I didn't know anyone. A friend recommended I go to Larkin Street.
That's where she found all the support she needed, all under one roof.
I got a bed and I got a case manager. That was 1.5 years ago. Since then, I got housing and I joined Larkin Street Youth Advisory Board. Larkin Street helped me prepare for college and navigate the system.
It was a place where she felt safe enough to ask for help.
Because of my mental health, Larkin Street is patient with me. They're very assuring, and that makes me feel comfortable enough to ask for help when I need it.
For staff, those moments are the measure of success. not simply treating an illness, but helping a young person regain enough stability to imagine a future.
I'm a sophomore in college now. I want to get my bachelor's degree, and with Larkin Street support, I want to get a good job and help my family back home. I want to bring back what I learned in America about LGBTQ issues, mental health, gender, and sexuality.
Yessie's story wasn't the result of one program or one clinician. It reflected a model San Francisco spent decades building. The Michael Baxter Larkin Street Youth Clinic has operated for about 30 years inside Larkin Street Youth Services in the Tenderloin, which had the city's highest concentrations of youth experiencing homelessness and substance use emergencies. The Cole Street Youth Clinic was embedded within Huckleberry youth programs in the Haight, where adolescent self-harm was highest. Huckleberry's commitment to vulnerable youth stretches back to 1967, when Huckleberry House opened the nation's first shelter for runaway youth.
That's how the house was originally created, as the first place for young people in the country to stay as minors. I'm Jackie Miller. I work at the Huckleberry Youth Health Center.
Miller said organizers quickly saw that a bed wasn't enough.
It became very clear that these clients often need medical care.
But a young person who distrusted every adult in authority wasn't likely to walk into a hospital, so the care came to them.
They were having a doctor come at the house in the basement of the house.
That effort eventually grew into the Cole Street Youth Clinic.
For over 30 years, we've been providing medical care, and it's like the foundation of all the other programs here.
Ever since the Summer of Love, when tens of thousands of them began pouring into the city. San Francisco's reputation was of a city that showed up for vulnerable young people. It didn't take long for local physicians to realize the city wasn't prepared for what was unfolding.
The community was total craziness. There was thousands of young people on the streets.
Dr. David Smith recalled those early days in a 2017 interview for UCSF's Campus News Service.
All the kids were tripping out on drugs.
They came looking for freedom, but many found themselves in desperate need of medical care, with bad drug reactions, injuries, infectious disease, malnutrition, untreated illness, and psychiatric crises. The prevailing attitude among much of society, including city leaders, was that these young people were undeserving of care.
You had a stigmatized, discriminated against population because you didn't like how they looked, you didn't like what they did, and therefore you were going to deny them health care, let them die, and make them go away.
In 1967, San Francisco Mayor John Shelley put it this way.
We do not have an obligation to feed these people, to house them, or to care for them.
But Dr. Smith and his colleagues weren't willing to turn them away, so they set out to build the kind of clinic they believed San Francisco needed.
The city actually tried to stop us through its regulations.
Officials feared that creating a, quote, hippie clinic would encourage more young people to come to San Francisco.
That's when I first said healthcare is a right, not a privilege. I opened the Haight-Ashbury Free Clinic in June of 1967.
And when they opened the doors,
there was about 250 young people lined up down the street. And they came in with gonorrhea and cut feet and colds and pneumonia. There was all the sex and there was all the drugs. So we were jammed from day one, running 24 hours a day.
It was built on a new idea, a clinic where young people would encounter no judgment, no insurance, no lectures, just care. And it started a movement.
After we started our clinic, there was about 400 free clinics nationwide, the National Free Clinic movement.
Eventually, even city leaders like Mayor Shelley recognized that something had to be done.
Illness, damage to persons physically through use of drugs, a continuing rise in the record of infectious hepatitis, which can come from several sources, not necessarily just the use of dirty needles for injection of drugs, but just from general unsanitary conditions.
He described the situation as a public health threat.
The problem with this city and all cities is the health problems that come up from the mode of living of some of these people, the inadequate sanitary facilities, and the possible menace to the health of the community.
That shifting approach to youth healthcare led into the 1970s, just as the city was confronting a dramatic rise in heroin deaths, with victims becoming younger. Then, another public health crisis transformed the work again. In the 1980s, HIV devastated San Francisco. And the epidemic was fueled not only by a virus, but by discrimination and stigma. For young people living on the streets, exchanging sex for a place to sleep, food, or protection, non-judgmental care could mean the difference between seeking help and staying away, and ultimately between life and death. That's when the Cole Street and Larkin Street clinics jumped in to lead HIV prevention, education, and compassionate care for young people, thanks in large part to two determined advocates living with HIV themselves. In the Haight, a residential counselor at Huckleberry House named Danny Keenan made HIV prevention his mission.
He was really, really passionate about making sure that young people had HIV education and prevention care. So he started a peer health education group.
Instead of adults lecturing teenagers, Keenan organized young people to educate each other about HIV prevention and sexual health. Meanwhile, in the Tenderloin, Michael Baxter, a youth program director with San Francisco's health department, helped build what would become one of the country's leading models of integrated care for vulnerable youth.
We're talking about unhoused youth. We're talking about youth that may have already been connected with juvenile hall.
Marcia Zarilla spent 25 years as a health educator in San Francisco's youth clinics, working alongside Baxter.
When we're talking about runaway youth, we're talking about the most vulnerable youth.
By the 1990s, federal officials studying programs serving runaway and homeless youth were documenting many of the same lessons San Francisco providers had learned. The most successful youth programs combine counseling, healthcare, outreach, and family support. A 1995 Justice Department review of drug treatment programs serving homeless youth found that drug use rarely existed in isolation. It was intertwined with homelessness, family conflict, trauma, and mental health challenges. Under Baxter's leadership, San Francisco expanded partnerships with schools and community organizations, creating a network of neighborhood clinics designed specifically for young people. The partnerships came to be known as Community Health Programs for Youth, or CHIPPY. Baxter died in 2015 at the age of 60. He was widely recognized for expanding health services for low-income, homeless, LGBTQ, incarcerated, and other marginalized youth. His influence was so pervasive and profound that the Larkin Street Youth Clinic now bears his name.
If I had to think of a word to describe Michael, I said he was fierce. He was a strong advocate for youth, all youth. And if he were alive, we wouldn't even be having this type of conversation, because he would be fighting to make sure that those clinics stay open. And I know that for a fact.
Baxter's vision didn't end with him. Years after his death, civic leaders were still embracing the same philosophy, that helping young people early meant bringing housing, healthcare, education, and employment together before homelessness became chronic. One of those leaders was Daniel Lurie. In 2018, 7 years before becoming mayor, Lurie stood outside Larkin Street Youth Services to launch a partnership with the city to reduce youth homelessness. He was then CEO of Tipping Point Community, a San Francisco nonprofit that funds organizations working to reduce poverty and homelessness.
Supporting the young people living on our streets requires an all-hands-on-deck solution.
The campaign was called Rise Up Youth.
We've established a clear metric along with the mayor, cutting homelessness for transition-aged youth by 2023.
San Francisco counted more than 1,100 homeless people aged 25 or younger that year. More than 80% of them lived unsheltered.
Even with the right metrics, the right partners, and the right leaders, you need the right strategy.
The solution city leaders advanced wasn't just to provide shelter, It was to reach young people early, connect them with housing, education, employment, medical care, and wraparound support before homelessness became permanent. The philosophy had even become official city policy. And while announcing the Rise Up campaign, Lurie specifically identified youth clinics, including Cole Street and Larkin Street, as part of San Francisco's primary care safety net.
These are our kids, the future of our city. What Tipping Point has learned over the course of 13 years is that when you support the right solutions, the right leaders, the right partnerships, great outcomes are possible. We've seen that with Larkin Street.
But now, after decades of serving young people, San Francisco is planning to dismantle the clinics. In early 2026, Lurie asked city departments to prepare for one of the most difficult financial years in recent memory. Congress had changed the rules governing Medi-Cal, California's Medicaid program. The changes reduced federal Medicaid funding by hundreds of millions of dollars, prompting California to make its own Medi-Cal spending reductions and forcing cities like San Francisco to fill much of the remaining gap. During his 2026 budget address, Lurie once again stood outside a service organization, this one a benefits center in the Mission, to talk about his priorities.
Using funding from the emergency reserve we set up last year to respond to sweeping federal cuts. We are dedicating $34 million to help San Franciscans stay on Medi-Cal and CalFresh. And we are committing $120 million to help families stay housed so that one missed paycheck or emergency medical bill doesn't lead to homelessness.
The Department of Public Health was instructed to cut $40 million from its $3.4 billion public health system without unraveling San Francisco's healthcare safety net. Department Director Daniel Tsai put it this way at a Health Commission meeting in April.
What we were presenting before the Commission at the Mayor's office request are the least bad set of things we could do so that we don't have to crater the entire safety net and healthcare services in San Francisco.
Among the proposals, and on-site primary care at 2 specialized youth clinics and a specialized geriatric behavioral health clinic. The projected savings, about $2 million a year. For many people, that number seemed impossibly small, exchanging 60 years of specialized youth care for only a few $1 million. Jackie Miller helps coordinate Huckleberry House programs.
It feels like they see young people as dollar signs. We saw the mayor's campaign when he ran and what he said he thought was important, and all his actions show the exact opposite. We're cutting costs to like a little over $1 million clinics, but we're seeing law enforcement raises that will cost the city hundreds of millions of dollars over the next few years. You can't not invest in young people. You can't expect the community to be built up of successful, intelligent, emotionally healthy individuals if we don't give that to them when they're young.
Inside the Department of Public Health, they said the city's financial reality had changed. Dr. Blake Gregory oversees San Francisco's network of primary care clinics.
These have been gut-wrenching decisions, really some of the hardest things that I've had to do in my career and things that we would not be doing in ordinary times.
She didn't claim that youth services were unimportant. In fact, just the opposite.
They serve youth ages 12 to 25, contraceptive care, family planning, STI treatment, and then other sort of like urgent needs as well as psychosocial behavioral health needs for this very vulnerable population.
But, she said, the city no longer had enough resources.
The staffing model is really designed to do quite well in times of abundance, not so well in times of austerity.
Public health officials said the clinics are underutilized, with Cole Street seeing about 257 unique patients over the previous year, and Larkin Street about 355. At the same time, Gregory said, adult primary care clinics were overwhelmed.
As of last week, we had 130 patients on a new patient wait list who do not have an alternative and they need services.
So the public health department would pivot. On-site clinic staff can connect patients by video to a health provider. Or young people can go to adult primary care, like the Tom Waddell Clinic near Larkin Street.
There's going to need to be some change management, but we've had to do a lot of this actually with all of our efforts to reduce opioid deaths and how do we just lower barriers, just make it easy for people to get what they need. And they're more than ready to do it with the young adult population as well, and I think it's achievable.
But to the people who run youth programs, the proposal isn't simply a change in where care is delivered. They say it dismantles a distinctly San Francisco model that was refined over decades to remove barriers by bringing services together in one place. Lisa Cadillo said she's watched young people try and often refuse to make the transition to adult clinics.
I would walk them over there. They would see the environment at Tom Waddell outside and inside. And they're like, oh no, these are adults who have been through the mud. I'm not dealing with, older people talking crap to me, and I'm pretty sure older people don't like having young people talk crap to them. And so that's kind of the dynamic.
Suzanne Zago, a Cull Street Youth Clinic behavioral health clinician of nearly 20 years, said the changes would undermine the youth-integrated model.
Young people are less likely to travel across town and have multiple appointments to get their needs met.
Zago told the Health Commission that the clinics weren't underutilized. They were under-resourced.
The reduced utilization of recent years was not a reflection of lack of need. It was a direct consequence of chronic understaffing that forced us drastically to reduce hours.
She said the Department of Public Health began gutting integrated youth health programs after COVID-19.
After reopening, we experienced wave after wave of losses. Medical directors, supervisors, providers, behavioral health clinicians, nurses, support staff, a total of 33 staff members. For the past year, we've been open only 2 days a week, sometimes half a day. Youth who showed up and found us closed did not come back. That is not a failure of the mission. It's a failure of resourcing.
Zago was among hundreds of people who showed up at City Hall budget meetings to protest funding cuts.
We welcome you to the May 18th, 2026 meeting of the San Francisco Health Commission.
Many waited for hours to make their case for saving the clinics. Public comment had been reduced to just 1 minute per speaker, so rather than make isolated pleas, clinic staff, patients, union representatives, and community partners coordinated a single presentation. One after another, speakers advanced the same slide deck, each using 60 seconds to explain a different piece of the story.
Youth healthcare is not measured only by unique bodies walking through the door. It is measured in relationships, in retention, in continuity, in repeat visits, in behavioral health encounters, in trust built over months and years.
The department and our managers didn't discover a failing program, they manufactured one.
Every single youth life matter, and that is what we're here for. We're here to be the advocates of those that can't voice what is happening in our community.
For hours, patients, clinicians, and community advocates repeated the same idea. These were places where trust had been built over years, where relationships changed the course of young lives.
I've met many former clients who have reflected on how important our services were to them as teens. For many, this was the first place they were able to receive confidential services without worrying about cost or parent involvement. Those young people are now teachers, social workers in the schools, healthcare providers, some of who have come back to work as nurses in our very same clinic. Our success is tangible and it can be measured by our results, such as lower transmission rates of HIV and STIs.
I was in a very abusive household before I graduated from high school, struggling with homelessness, struggling with no job. I went to the clinic, and Lisa has saved my life by giving me another chance to build my self-esteem up. If you take these clinics away, it really will kill a lot of people.
Again and again, they returned to the same argument. The city was asking its most vulnerable residents to shoulder the burden of the budget crisis.
This decision ultimately rests not on the department, but on the Health Commission, on Mayor Lurie, and on the Board of Supervisors. So I say to you all, please, do not balance this budget on the backs of medical providers, therapists, case managers, health educators, Huckleberry Youth Programs, or the young people who will inevitably carry the impact of these closures for years to come.
A few weeks later, the Board of Supervisors met to decide what items on the long list of proposed budget cuts would they save, and what would they let drop.
We restored $20 million in the essential service cuts, services supporting our seniors, employment opportunities for youth, critical programming and services for our LGBTQIA, transgender, Latinx, BIPOC communities. We fully funded Free City College. We also have funded HIV prevention and healthcare services.
One community service group after another celebrated the reprieve of their funding cuts, but the clinics never came up. That's when supporters found out. The proposed clinic closures were never part of the city's budget process after all. The health director, Daniel Tsai, had said things like,
At the mayor's office request,
and
the comments that we get, we will be passing along to the mayor's office as part of the budget process.
And
the budget is with the mayor's office.
So,
what the hell is going on?
Sophia Padilla is a behavioral health clinician at Larkin Street who has been campaigning at City Hall and in the media to save the clinics.
Why am I here? What is there to advocate for with the Board of Supervisors if they have very little power to add us back to anything?
Then came the explanation. The closures had been an operational decision by the Department of Public Health all along. Elected officials had no say in the matter. The experience forced her to rethink how much power City Hall actually has.
I now have a friendly relationship with my District 5 supervisor, Bilal Mahmoud, and I've met with him a few times about these clinic closures. And then he has very little power to do anything about saving clinics within his own district.
Despite the blow, Padilla said she's determined to pivot her efforts.
Made me feel like, we have to talk about it in a different way now.
According to Jenny Smith-Camejo, spokesperson for the Service Employees International Union, Local 1021, which represents many San Francisco public health workers, the next step was a formal meet and confer process. The union's ultimate goal is to keep the clinics open and properly resourced. Grassroots organizers spent decades building coordinated, culturally responsive care for vulnerable youth and securing public support. And what began as a grassroots movement eventually became city policy. Now, Department of Public Health officials say those services can be provided through a different model. Whether that model can preserve the trust, accessibility, and relationships that made the specialized clinics unique remains unknown. For the clinicians, former clients, and advocates who spent months fighting to keep them open, the question is, will the next young person walking into Larkin Street or Huckleberry still find everything they need? Or will they have to navigate a complex healthcare system that once came to them? I'm Sylvie Sturm. Thanks for listening. Civic comes to you from the San Francisco Public Press. Find all our reporting at sfpublicpress.org. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Our team includes Executive Director Lila LaHood, KSFP Program Director Mel Baker, and Director of Partnerships Lisa Rudman. Civic airs Tuesdays and Thursdays at 8 a.m. and 6 p.m. on our radio station, KSFP LP 102.5 FM in San Francisco. Subscribe to our podcast by looking for Civic from the San Francisco Public Press wherever you get your podcasts. Thanks for listening.